Is the portfolio diet the best diet ever?
The world of nutrition and dieting is filled with a dizzying array of options.
From trendy food plans like keto and paleo to calorie counting strategies, everyone seems to have a different approach to achieving optimal health.
However, one lesser known but highly effective approach has been steadily gaining attention in recent years: the portfolio diet. But is the portfolio diet really the best diet ever? In this article, we will explore what the portfolio diet is, how it works, its health benefits, and whether it might be the ideal diet for you. What is the portfolio diet?
The portfolio diet is a plant-based, heart-healthy diet developed by Dr. David Jenkins and his team in the early 2000s.
The diet was specifically designed to lower cholesterol levels and reduce the risk of heart disease. Unlike many traditional diets that focus on calorie restriction or macronutrient ratios, the portfolio diet revolves around a combination of specific foods that, when consumed together, work synergistically to improve heart health and metabolic function. The diet earned its name from the fact that it uses a portfolio, or combination of several dietary elements known to lower cholesterol levels. These include soluble fiber. Found in oats, beans, lentils, and certain fruits, soluble fiber helps reduce LDL cholesterol, often referred to as bad cholesterol.
Plant sterols. These compounds, which are naturally present in fruits, vegetables, nuts, and seeds, help block cholesterol absorption in the intestines.
Soy protein. Soy-based foods like tofu, tempeh, and soy milk have been shown to lower cholesterol levels when incorporated into the diet. Nuts, particularly almonds and walnuts, which provide heart-healthy fats and have cholesterol-lowering effects. Plant oils. Unsaturated oils, such as olive oil, are included for their heart-healthy fats, which help lower LDL cholesterol. These components, when combined, create a powerful dietary portfolio that targets multiple aspects of heart health simultaneously, especially by lowering bad cholesterol and promoting overall vascular function. How does the portfolio diet work? The portfolio diet works through a multifaceted approach to reducing cholesterol and improving cardiovascular health. Let's break down how the individual components of the diet contribute to these benefits. 1. Soluble fiber and cholesterol reduction. Soluble fiber plays a crucial role in lowering cholesterol by binding to cholesterol in the digestive tract and preventing its absorption. When you eat foods like oats, beans, lentils, and fruits, especially apples and citrus, the soluble fiber binds to bile acids, which are made from cholesterol, and removes them from the body. The liver then has to use cholesterol to make more bile, thereby lowering cholesterol levels in the bloodstream. 2. Plant sterols and cholesterol absorption. Plant sterols, which are found in a variety of plant-based foods, have a structure similar to cholesterol. This similarity allows them to block cholesterol molecules from being absorbed in the intestines. When consumed regularly, plant sterols can lower LDL cholesterol levels by up to 10 to 15%. Foods like fortified margarines, nuts, seeds, and vegetable oils are excellent sources of plant sterols. 3. Soy protein and heart health. Research has shown that soy protein can reduce total cholesterol levels, particularly LDL cholesterol. Soy products such as tofu, tempeh, edamame, and soy milk are rich in proteins that, when replaced with animal-based proteins, can help lower cholesterol levels. Soy contains compounds called isoflavones, which may also help improve blood vessel function and reduce inflammation. 4. Nuts for healthy fats. Nuts like almonds, walnuts, and pistachios are rich in heart-healthy unsaturated fats, fiber, and plant sterols, all of which contribute to their ability to lower LDL cholesterol. Walnuts, in particular, are rich in omega-3 fatty acids, which help reduce inflammation and improve overall heart health. Studies suggest that incorporating nuts into a diet may help reduce cholesterol and decrease the risk of heart disease. 5. Unsaturated oils and cardiovascular benefits. Unsaturated oils, especially olive oil, are a cornerstone of the portfolio diet. These oils are rich in monounsaturated fats, which have been shown to lower LDL cholesterol while maintaining or increasing HDL, good, cholesterol. Additionally, olive oil contains antioxidants that can help reduce inflammation and oxidative stress, which are key factors in the development of heart disease. Health benefits of the portfolio diet. While the primary aim of the portfolio diet is to reduce cholesterol and promote heart health, its benefits extend beyond just lowering cholesterol. Some of the health benefits associated with this diet include: 1. Heart disease prevention.
The portfolio diet is designed to combat the major risk factors for heart disease, including high cholesterol, high blood pressure, and inflammation. Studies have shown that the portfolio diet can reduce LDL cholesterol by up to 20 to 25%, significantly lowering the risk of cardiovascular events like heart attacks and strokes.
2. Weight management. Although the portfolio diet is not explicitly a weight loss diet, the emphasis on plant-based foods, such as whole grains, vegetables, fruits, and legumes, can naturally support healthy weight loss. These foods are high in fiber and protein, which help keep you feeling full and satisfied for longer, reducing overall calorie intake. 3. Improved blood sugar control. The portfolio diet's focus on high-fiber foods and plant-based proteins can also help stabilize blood sugar levels, making it a potentially beneficial diet for individuals with type 2 diabetes or insulin resistance. Fiber slows down the absorption of sugars, preventing spikes in blood glucose. 4. Reduced inflammation. The unsaturated fats found in nuts and plant oils, combined with the antioxidants from fruits and vegetables, work together to reduce inflammation.
Chronic inflammation is a major factor in the development of many chronic diseases, including heart disease, diabetes, and certain cancers.
Is the portfolio diet the best diet ever? The portfolio diet has a lot going for it. It is scientifically supported. Numerous studies have demonstrated its effectiveness in lowering cholesterol and improving heart health. Sustainable. Unlike many fad diets, the portfolio diet promotes a lifestyle of balanced, whole foods that are sustainable in the long term. Heart healthy. The diet specifically targets heart disease, making it an excellent option for people at risk of cardiovascular problems. Plant-based. Emphasizing plant-based foods can be beneficial not only for heart health but also for the environment and reducing reliance on animal products. However, the portfolio diet may not be the best fit for everyone. Some potential drawbacks include:
time and effort. Preparing plant-based meals, particularly those with specific ingredients like soy protein and plant sterols, can require more time and effort compared to more straightforward diets.
Lack of variety. For some people, the focus on specific foods like oats, beans, and soy products can feel repetitive or restrictive. Calorie-dense nuts. While nuts are heart-healthy, they can also be calorie-dense, which may be a concern for individuals trying to manage their weight. Overall, the portfolio diet is an evidence-based, heart-healthy approach to eating that can offer significant long-term benefits. It's particularly well-suited for individuals with high cholesterol or those at risk for heart disease. Whether it's the best diet ever depends on your specific health goals, preferences, and lifestyle.
Conclusion. Is the portfolio diet right for you?
While the portfolio diet is undoubtedly a strong contender for the title of the best diet ever, its success ultimately depends on individual health needs, preferences, and lifestyle. If your primary goal is to improve heart health, manage cholesterol levels, and maintain a sustainable, plant-based diet, the portfolio diet might be an excellent choice. As with any diet, it's important to consult with a healthcare provider or nutritionist before making major changes to your eating habits, especially if you have existing health conditions. With the right support and commitment, the portfolio diet can lead to long-term health benefits and a better quality of life.